Morning to all. Today we are going to discuss one of the most important cardiac emergency of the heart, that is cardiac tamponade. Cardiac tamponade is a serious medical condition in which blood or fluids fill the pericardial space between the sac that encases the heart and the heart muscle. This places extreme pressure on the heart so that the pressure prevents the heart ventricles from expanding fully and keep the heart from functioning properly. And so the heart can't pump properly. Next we can see the definition of cardiac tamponade. Cardiac tamponade is a clinical syndrome caused by accumulation of fluid in the pericardial space resulting in reduced ventricular filling and subsequent hemodynamic compromise. Cardiac tamponade is a medical emergency. Another definition: cardiac tamponade is cardiac dysfunction caused by external compression of the heart by accumulation of excessive contents in the pericardial space. One more definition is also here. You can learn any one definition. So here the other definition is cardiac tamponade is the accumulation of excess fluid within the pericardial space resulting in impaired cardiac filling, reduction in stroke volume, and epicardial coronary artery compression with resultant myocardial ischemia. This fluid, which can be a blood, pus, or air in the pericardial sac. Accumulation may cause the heart to compress as well as restrict the blood flow in and out of the ventricles. Next is the incidence. Incidence, mostly 2 to 5 cases can be there among the 10,000 population. 2% may be caused due to penetrating injuries resulting into cardiac tamponade. Related to the male is to female ratio, 1.25 is to 1 is the male is to female ratio. Next we can see the etiology. Etiology means causes of cardiac tamponade. Cardiac tamponade develops due to pericardial effusion. What do you mean by pericardial effusion? Pericardial effusion means accumulation of excess fluid in pericardial space. It may occur rapidly or insidiously. So next we can see the causes of rapid pericardial effusion. So causes of rapid pericardial effusion are maybe due to trauma, either may be due to both stabbing or blunt injuries, post myocardial infarction. That means some patients may used to develop MI. No, after MI the person may used to develop this particular problem. After heart surgery, either it may be an open heart surgery or CABG, aortic dissection. Drugs and medications also cause the particular problem. For example, antihypertensive drugs may also used to cause this particular problem. Other causes are insidious pericardial effusion. This may be caused due to cancer which spread in lungs or in the breast. 30 to 60% of the breast as well as lung cancer causes this particular problem. Then infections may be due to viral, bacteria or fungal infection. Then uremic pericarditis, 10 to 15% of the uremic pericarditis may cause this cardiac tamponade. Hypothyroidism, chronic inflammation of connective tissues in case of systemic lupus erythematosus as well as rheumatoid arthritis or rheumatoid problem may also cause this particular problem. High level of radiation to the chest and even kidney failure are also used to develop this particular problem. Next we can see the pathophysiology. Pleural effusion due to various causes exert pressure in the heart walls. This may impair relaxation and filling of the ventricle chambers do not fill properly. So due to this the cardiac output will be decreased, and the decreased cardiac output will cause hypotension, shock, then reflux as well as tachycardia. At the same time, this may cause increased venous pressure and leads to systemic congestion as well as pulmonary congestion. Systemic congestion causes increased jugular venous pressure hepatomegaly, ascites as well as peripheral edema. Pulmonary congestion causes rales in the lungs. Hope you understood the pathophysiology. Pleural effusion due to various causes exert pressure in the heart walls, impair relaxation and filling of the ventricles. The chambers do not fill properly. This leads to decreased cardiac output as well as increased venous pressure. Decreased cardiac output causes hypotension, shock, reflex as well as tachycardia. Increased venous pressure causes systemic congestion as well as pulmonary congestion. Systemic congestion leads to increased jugular venous pressure, hepatomegaly, ascites and peripheral edema. At the same time, pulmonary congestion causes rales in the lungs. Next, we can see the clinical manifestations of cardiac tamponade. So, what are the signs and symptoms the person may use to develop means chest discomfort, pleuritic pain. Pleuritic pain means painful lungs. That means pain in the chest caused due to painful lungs. Then tachypnea, dyspnea on exertion that progress to air hunger at rest also. Even at rest they can't able to have the normal respiration. These are the major key symptoms. The person may use to develop convulsion, unconsciousness. Most patients are weak and faint at presentation and can have vague symptoms such as anorexia, dysphagia and cough. The initial symptom may also be one of the complications of tamponade such as renal failure. Next we can see the diagnostic evaluations. First important diagnostic measure is the history collection. With the help of history collection we can able to identify by just asking the precipitating factors, onset, causes and related to the symptoms. By identifying the symptoms we can able to suggest the person may have this problem. Then by conducting physical examination, Beckstrand pulsus paradoxus. So what do you mean pulsus paradoxus? A drop of at least 10 mmHg in arterial blood pressure on inspiration is the pulsus paradoxus. There may also be a general signs and symptoms of shock, tachycardia. So in tachycardia means the pulse rate will be more than 90 beats per minute. Patient may use to develop breathlessness, decreased level of consciousness. Sometimes the person may develop bradycardia also, uremia and even hypothyroidism also the person used to develop. Then drug made in mostly in the lungs we can able to hear the friction rub. Then computerized tomography, CT scan, with the help of CT scan we can able to confirm whether the person is having extra fluid in the pericardium. Then MRI means magnetic resonance angiogram. With the help of this MRI we can able to identify the abnormalities in the blood flow through the blood vessels of the heart. Next we can see the complications. The major complications of cardiac tamponade are heart failure, pulmonary edema, bleeding, shock and death. So what are the complications of the cardiac tamponade means? Heart failure, pulmonary edema, bleeding, shock and even death may used to happen, and hence we are telling this as a major cardiac emergency. Next we can see the medical management. The main aim of particular treatment for this particular cardiac tamponade is we need to save the particular patient's life. Next aim is we need to improve heart function and relieve the signs and symptoms. So we want to focus what all the treatment focus means. First thing is IV fluids in order to maintain normal BP. Then next is the antibiotics, supplemental oxygen to reduce the workload on the heart. Next important thing is we need to provide bed rest and we can elevate the leg. Next is anotropic drugs, for example dobutamine. Then we can provide mechanical ventilation with positive airway pressure. Mechanical ventilation with the positive airway pressure should be avoided in patients with the tamponade because this may further decreases cardiac output. Okay, so the mechanical ventilation with positive airway pressure should be avoided. Next is the surgical management. So regarding the surgical management, pericardiocentesis can be done to such patients. What do you mean by pericardiocentesis means? It's also called as pericardial tap. It's a surgical invasive procedure. This can be done both for diagnostic as well as therapeutic purpose. So in which abnormal or excessive fluid is removed from the pericardial sac. So pericardiocentesis means is a removal of the excess fluid with the help of needle in the pericardial space for the purpose of diagnostic or therapeutic purpose. Next we can see the nursing management. As a nurse, what all the management measures we have to do means we want to strictly monitor the vital signs, especially respiratory frequency, give semi-Fowler's position if not contraindicated, give oxygen if indicated, monitor urine output hourly. Sometimes a drop of urine output may occur and this may indicate decreased renal perfusion as a result of decreased stroke volume secondary to cardiac compression. Continuously monitor the ECG for arrhythmias. Arrhythmias means abnormal heart rhythm. Monitor the BP every 5 to 15 minutes during the acute phase. Auscultate the lungs for abnormal breath sounds as well as the abnormal heart sounds. Listen the murmurs. Murmurs can also be identified while auscultating the heart. Then maintain bed rest in a comfortable position during the acute period. Educate the patient as well as the family members regarding the disease condition and the treatment measures. Educate about the invasive procedure, that is pericardiocentesis is the invasive procedure. So you explain the pre-operative care, post-operative care and the intra-operative care to the patient as well as to the family members. Encourage the patient to clarify the doubts. Next thing is, based on the complaints of the patient, we need to frame the nursing diagnosis and we want to provide proper nursing care to the particular patient so that we can able to save the life of a particular patient. So the most important complaint of the patient will be breathing distress. The patient may used to have ineffective breathing pattern, then impaired cardiac output, then they used to have fatigue, it is activity intolerance. For that we can able to frame nursing diagnosis. First one is the ineffective breathing pattern related to hyperventilation as evidenced by dyspnea. So based on the particular patient's problem, we want to provide nursing care and we want to evaluate for further care. Decreased cardiac output related to decreased ventricular filling secondary to increased intrapericardial pressure as manifested by tachycardia. The next one is activity intolerance related to shortness of breath and chest discomfort as manifested by restlessness and fatigue. So you can also create more nursing diagnosis based on the patient complaints and you can provide appropriate nursing care to the patient and you want to evaluate the outcome of the particular patient care. Hope you have understood this particular topic. Thank you so much.